Hello, my name is Jun Chul Park. I'm clinical assistant professor in Yonsei University College of Medicine in Seoul, Korea. It is my great pleasure to introduce my recent published article in GIE, named as Prediction Model for Non-curative Resection of Endoscopic Submucosal Dissection in Patients with All Gastric Cancer. Increases in screening programs and development of endoscopy instruments have contributed to the detection of gastric cancer in the early stages, especially in Asian countries. And ESD is now widely accepted as the optimal endoscopic treatment method for all gastric cancers, and expanded criteria have been applied to a broader selection of ESD cases. Today, the number of ESD cases were increasing, so the number of cases of additional surgery after ESD will also increasing. However, ESD is not guaranteed as a perfect method for the management of EGC. Sometimes patients who were judged to be within the criteria before the procedure can be determined to be beyond the expanded indication based on the final pathology reports. Usually, these patients undergo additional surgery after ESD. In deciding on a treatment method for EGC that is considered to be within the expanded criteria, both patient and doctors may feel burdened by the probability of additional surgery. Because additional surgery after ESD can lead to waste of medical resources and expense and increase the risk of adverse events. Therefore, to avoid unnecessary procedures, clinicians usually strive to select suitable patients with EGC who met the criteria before procedure, not after procedure. However, until now, there has been no accurate model that can predict non-curative resection of ESD in patients with EGC. And this kind of predictive model can be very useful to both doctors and patients in clinical field. Therefore, we constructed this study to reduce the rate of unnecessary operation with non-curative resection by using both surgical database and variable endoscopic findings in our institution. Various risk factors associated with non-curative resection of ESD and EGC or lymph node metastasis have been published in recent studies. However, studies focus on various endoscopic growth findings, including atrophy, exudate, ulceration, or fold shape, etc., are very rare. We want to find the useful clinical risk factors and establish a predictive model that can be used before deciding whether to perform ESD, not after ESD. So we retrospectively reviewed the clinical data of patients who underwent ESD at Severance Hospital from January 2007 to December 2013. The clinical pathological characteristics of patient and the growth finding of cancer lesion that could be obtained before ESD were compared between the non-curative resection group versus curative resection group to identify the risk factors associated with non-curative resection of ESD. Especially, we examined various endoscopic findings of EGC, including ulceration, the shape of gastric folds, elevate margin, exudate, scar, atrophy, and spontaneous bleeding, which were the factors that could be found out easily before ESD. And we made a predictive model for non-curative resection of ESD according to these risk factors that shows statistical significance between two groups. Risk score was constructed in the testing set by using multivariate logistic regression with non-curative resection as the outcome. Comparing non-curative ESD and curative ESD group, we found that 7 factors were significantly different between two groups in the multivariate analysis. 7 factors were large tumor size, tumor location in the upper body, and ulceration and fusion of gastric folds, absence of mucosal nodality, spontaneous bleeding, and undifferentiated tumor histology. Points of risk Points of risk scores were assigned to these variables, and risk scores range from 0 to 8. As the total risk score increased, the risks for non-curative resection of ESD increased from 7% to 75%. Our prediction score model showed good discriminatory performance among the 2,000 bootstrap internal samples. For example, a score of 6 or higher showed a 67.6% for a risk for non-curative resection. Those patients can be classified into the high-risk group. Therefore, this scoring method can be used easily in the clinic. Clinicians can pay close attention to patients who are classified in the high-risk group, and this can lead to reduction in unnecessary procedure and medical expenses. In addition, we can show easily to the patient about the possibility of additional surgery if the patient underwent ESD. The significance of this study is that a predictive model for non-curative resection was developed using clinically variable factors, especially including endoscopic growth findings. Next step is we are planning to perform external validation to demonstrate the accuracy of our model. Thank you for your time.